Top warning signs: you have a fatty liver. Welcome to our Health Fitness channel. Affecting millions of individuals globally, fatty liver disease is a major medical issue. When too much fat builds up in the liver cells, this disorder results, and if untreated, might cause major problems. Although early on in its development, fatty liver might frequently show no symptoms, there are various warning indicators that can point to its existence. Top signs of a fatty liver will be discussed in this extensive video, therefore enabling you to understand the need of early diagnosis and treatment. 8. Upper right abdominal pain. A further warning symptom of fatty liver disease is upper right abdominal pain or discomfort. This region matches the site of your liver, which on the right side of your body rests somewhat under your rib cage. A dull aching to a more severe or stabbing feeling is the spectrum of discomfort connected with fatty liver. It could be sporadic or continuous and aggravate after heavy or fatty meals. This pain results from fat building up in the liver, causing the organ to grow, therefore straining the liver's capsule and may be aggravating surrounding nerves. Though not everyone with fatty liver disease exhibits this symptom, the discomfort may be readily mistaken with other gastrointestinal problems. See a healthcare expert for a correct diagnosis if you have ongoing upper right stomach discomfort, particularly if other symptoms on this list also apply. 7. Fatigue. One frequent but often disregarded complaint of fatty liver disease is chronic tiredness. Many persons with this disorder claim to be always exhausted, even after enough sleep. Your everyday activities, performance at work, and general quality of life may all be hampered by this tiredness. Though the precise reason of this tiredness is unknown, it is thought to be connected to the liver's decreased capacity to efficiently store and utilize energy. Furthermore, the inflammation brought on by fatty liver disease might set off molecules known to induce tiredness, called cytokines. Although it is a non-specific symptom linked to many different medical illnesses, including depression, thyroid problems, and sleep apnea. Tiredness is particularly common among those with still. Chronic tiredness shouldn't be dismissed when taken with other indicators of liver malfunction. If your inexplicable exhaustion does not go away with rest, you should talk to your doctor and take into account the potential of fatty liver disease as part of a thorough health assessment. 6. Elevated liver enzymes. Rising liver enzymes, especially alanine aminotransferase, ALT, and aspartate aminotransferase, AST, are one of the main signs of fatty liver disease. Usually present inside liver cells, these enzymes seep into the circulation when the liver is damaged or inflammatory. Higher than normal levels of these enzymes revealed by a blood test may point to liver malfunction. Although certain drugs, alcohol use, and other liver diseases may all contribute to raised liver enzymes, these are not the only causes. Still, in the setting of fatty liver disease, constantly elevated ALT and AST values might be a sign of trouble. Should recent blood tests reveal increased liver enzymes, it is important to follow up with your physician for further assessment and maybe imaging tests to evaluate the state of your liver. 5. Abdominal swelling, ascites. As fatty liver disease advances, it may cause a disorder known as ascites, marked by fluid collection in the abdominal cavity. Along with a sensation of fullness or pressure in the belly, this swelling may be somewhat uncomfortable. Ascites is the result of scarring of the liver that causes ineffective control of fluid balance, therefore causing fluid retention in the abdomen. Apart from the obvious swelling, those with ascites may have trouble breathing, particularly while laying down as the collected fluid compresses the diaphragm. Abdominal swelling demands quick medical treatment and might be an indication of severe liver disease. See a doctor if you have ongoing or worsening stomach swelling, especially if other symptoms accompany it. 4. Fat belly. Although not everyone with a protruding belly has fatty liver disease, this illness is strongly correlated with extra abdominal fat. A big belly might be a sign of visceral fat buildup, especially if it feels solid instead of soft. The kind of fat that envelops internal organs, including the liver, is visceral fat. A fatty liver condition may result from this fat accumulating around the liver. Complicating the association between abdominal obesity and fatty liver include elements like insulin resistance, inflammation, and hormonal abnormalities. It's crucial to know that carrying extra fat around the belly may cause fatty liver even in people who are not notably obese. Important factors in avoiding and controlling fatty liver disease related with abdominal obesity include regular exercise, a balanced diet, and weight maintenance.
If you found this video helpful, please like, share, and subscribe to our channel for more health-related content.
3. Enlarged liver. A major warning indication of fatty liver disease is an enlarged liver, also referred to as hepatomegaly. The organ expands and grows more than it should when fat builds up in the liver cells. Your doctor can usually feel this protrusion on your belly during a physical examination, even if you may not be able to find it on your own by light pressure. Sometimes an enlarged liver causes upper right section of the belly to feel full or uncomfortable. Ultrasounds, CT scans, or MRI are among advanced imaging modalities that may provide a more finely detailed picture of your liver's size and state. Though not just fatty liver disease, an enlarged liver may be indicative of other liver diseases. But when taken with other risk factors like diabetes, obesity, or high cholesterol, a larger liver strongly points to the existence of fatty liver disease. Early identification and therapy of this problem depend critically on regular checkups and quick medical intervention should you see any changes in your abdomen. 2. Jaundice. Jaundice is among the most obvious and worrisome indicators of liver malfunction. Bilirubin accumulation in the body causes this disorder to show up as yellowing of the skin and whites of the eyes. Made when the liver breaks down old red blood cells, bilirubin is a yellow-orange pigment. This chemical is handled and eliminated effectively in a healthy liver. But when too much fat builds up inside the liver, its capacity to control bilirubin suffers. This pigment may therefore build up in the circulation and provide the typical yellow tint associated with jaundice. Not just fatty liver disease, but also other liver disorders may be indicated by jaundice. Should you see yellowing of your eyes or skin, you should consult a doctor as once to have a correct diagnosis and recommended treatment. 1. Dark urine. Urine color changes are another possible clue for fatty liver disease. Depending on amount of hydration, healthy urine usually varies from light yellow to amber. On the other hand, if you often find that your pee is abnormally black, like cola or strong tea, this might indicate liver problems, including fatty liver disease. This darkening results from the liver's inability to efficiently metabolize bilirubin, which is then eliminated in more concentrated form via urine. Dark urine may also be caused by certain drugs or dehydration. Therefore, it's important to take additional consideration and see a doctor should this symptom last. One easy yet efficient approach to monitor your liver condition and general well-being is by tracking the color of your urine. Ultimately, these warning indicators may be rather important in spotting possible liver disorders, like fatty liver disease. Remember, however, that these symptoms might also be suggestive of other medical disorders. If you exhibit any of these symptoms, particularly in concert, you should see a healthcare provider for a comprehensive assessment. For those with fatty liver disease, early identification and treatment may dramatically affect results. You may help your liver function and general well-being by keeping a good lifestyle comprising a balanced diet, frequent exercise, and avoidance of too much alcohol. Recall that many body processes depend on the liver, hence maintaining it is an investment in your long-term health.
This video is for educational purposes only and is not a substitute for professional medical advice. All information here is verified by professional researchers. Stay healthy. Take care.